According to the American Physical Therapy Association, APTA, physical therapy is a form of treatment used to help and assist problems that may make it difficult to do daily activities. Physical therapy helps relieve pain after an injury or surgery, as well as restores one's movements that were once difficult. The goal of physical therapy is to assist and make daily activities easier for one who has struggled with such. This may be activities such as going upstairs, taking a shower, or walking up a hill. It helps with muscle and joint movements in areas of the body such as the knee, elbow, fingers, and neck. Physical therapy covers the entire body. There are specialists in specific areas of the body. According to Don Rosenberg-McKay, physical therapy is a developing career that is becoming very popular. Employment of the field is expected to grow 30% through 2018. According to Minority Nurse, as of 2003, 204 physical therapy programs were accredited by the APTA. 140 offered a master's and 64 offered a doctorate program. Both a master's and a doctorate are accepted as a physical therapist, but the doctorate is becoming more popular because it's the direction that most physical therapists are moving toward. A doctorate is an additional 1 to 2 years of school with a higher pay than physical therapists with a master's. Other than that, there's very little difference between the two degrees, except a doctorate gives a wider range of knowledge and more clinical experience before entering the work world as an independent physical therapist. It allows a better practice of one's skills before becoming independent. According to Minority Nurse, the mean average of a physical therapist makes is around $72,000 a year. Physical therapy covers the entire body. There are specialists in certain areas, though. There are specialists of certifications that are available in cardiopulmonary, clinical electrophysiology, neurology, orthopedics, pediatrics, sports, women's health, and geriatric physical therapy. Specifically in geriatric physical therapy, in 1989, the APTA House of Delegates approved board certification of the area of geriatrics. The first geriatric specialist certification examination was given in February 1992. As of June 2010, the American Board of Physical Therapist Specialists has certified 1,109 geriatric specialists. As a geriatric physical therapy specialist, you often work with patients with arthritis, osteoporosis, cancer, Alzheimer's disease, hip and joint replacement, and balance disorders. What is geriatric physical therapy to you?
Geriatric physical therapy is a rehabilitation with the elderly patients. It would consist of just different kind of treatments or therapies to try to help them not just to get back to a certain level if they had an injury, but also like prevention of diseases and to make sure that they don't have that happen to them again or in the future. The kind of people I'd be working with is mostly the elderly. They are probably above 65, is mostly geriatrics, but also depends on their condition and even just their health in general. Also, you'd be working with OTs as well as nurses and doctors. You have to coordinate with everybody to make sure that you have the right kind of care to provide that patient. I mean, it's always important to make sure that the patient gets the best treatment, and cooperation for all health professionals will do that.
The geriatric area of physical therapy is a fantastic area to work in. Geriatric physical therapy is a physical therapist working with patients who are older, sometimes referred to as elderly patients, but certainly anyone who is aging, and that's certainly a large portion of our population. And it's working with them across different practice pattern areas: the musculoskeletal area, neuromuscular, cardiopulmonary, and integumentary areas of physical therapy practice.
What types of people do you work with?
Individuals could be who would be seen by a geriatric physical therapist or for physical therapy may have diagnoses that were from the musculoskeletal area, such as patients who have undergone a knee replacement or a hip replacement. Could be patients who have undergone sustained some type of trauma to their neuromuscular system, like a patient who's had a spinal cord injury or a stroke, someone who's had a traumatic brain injury. It might be working with patients in the cardiopulmonary area of practice, individuals who have had a heart attack or a myocardial infarction, patients who might have pulmonary or breathing difficulties and they're having difficulty functioning. We also might be working with patients who have trouble with their integumentary system, which is their skin, and might have developed a wound due to a diagnosis of diabetes, peripheral vascular disease, all which increase with aging.
Many of my fellow physical therapy students discuss the various fields they may want to work in. Many do not realize how often that they will come upon working with a geriatric patient. It is more common, one may think, that a physical therapist may work with an older adult. Due to the baby boomers, an amount of geriatric patients is expected to greatly increase in the next 10 years. It is because of this that there is a greater need for physical therapists in the geriatric field. A geriatric therapist works with older adults in areas such as nursing homes, hospitals, and homes of individual patients. They work with issues such as arthritis, cancer, osteoporosis, and hip and knee replacements. It is a field that is becoming more popular and growing as the years progress.